Strong primary care is the strongest anti-inequity mechanism that we have.
Family medicine residents and family physicians can stand tall and proud. Their contributions to Canadians, to citizens, and the healthcare system are enormous.
Family physicians are some of the nicest people I know who care about their patients and their communities. They also have great insights into questions about family medicine.
Family physicians really provide cradle-to-grave care. They walk with patients over the course of their lifetime, from delivering babies to providing end-of-life care. It is the privilege of family medicine to share that journey with patients.
Eventually, we hope to change the pattern of society and the change pattern of the healthcare system from a reactive approach, responding to the development of disease once it happens, to a proactive approach in terms of preventing disease before it happens.
On étudie les problèmes de santé tels qu'ils se manifestent dans la communauté, dans nos cabinets, dans les hôpitaux régionaux, comme la majorité des gens les expérimentent.
Family medicine is the foundation of Canada's healthcare system. Family physicians, family medicine residents, and other primary care providers are proud of the work they do to support the well-being of communities and of people across the country.
Dans un système de soins de santé robuste, les soins primaires sont le premier point de contact pour la plupart des personnes qui ont besoin de soins.
A 2015 study published in the Canadian Family Physician by a team of primary care researchers illustrates this point well. They found that on average, for every 1,000 people, there were 238 contacts with family physicians per month, compared with 70 contacts with other specialist physicians.
On est à l'interface de la santé publique et de tout le système de soins et de prévention.
Studies have shown that health systems with a strong primary care sector have better population health outcomes, greater health equity, and often lower healthcare costs. Much of this evidence has been generated by family physicians and other primary care researchers. We celebrate the CFPC section of researchers for the work they do in extending and improving the quality of life for Canadians.
The other really important aspect of primary care is that it provides person-focused care. It delivers care that is most likely to benefit the individual and what matters to them.
Dr. Ian McWhinney, l'un des plus grands penseurs et leaders en médecine de famille au Canada, a aussi démontré pourquoi les médecins de famille occupent une place aussi importante en santé et en soins de santé. Ces travaux de recherche ont démontré qu'une méthode clinique axée sur les patients améliore leur santé, leur bien-être et leur perception des soins.
On a un potentiel d'avoir des patients qui sont davantage efficaces dans leur prise en charge de leur maladie chronique. Donc, ça veut dire moins de consultations à l'urgence, ça veut dire moins de prise en charge par les spécialistes, moins de complications ou un retard des complications reliées aux maladies. Donc, le potentiel de coût-bénéfice, il est énorme à partir du moment où on s'intéresse à optimiser les pratiques de première ligne.
In 2020, we mark the 25th year of this section of researchers, and we thank all primary care researchers for their efforts to improve the health and lives of all people.
We know that most of the healthcare that is provided in our healthcare system happens in primary care. And so it's really important that the research happens where most of the care is provided.
Le travail des chercheurs en médecine de famille à l'échelle du pays touche de nombreux aspects des soins de santé.
And the breadth of research being undertaken is incredible. It relates to health services, access to care, to primary care, management of chronic diseases, management of comorbidities and caring for patients with comorbidities, addressing inequities in the healthcare system.
Ce qui intéresse beaucoup les médecins de famille et les intervenants de première ligne, et ce qui est spécifique à leur recherche, c'est que nous, on s'intéresse à des aspects qui ne sont pas couverts dans d'autres recherches, comme par exemple des aspects relationnels, l'approche centrée sur le patient, par exemple, la décision partagée, comment on organise les soins de première ligne, comment on peut tirer profit des soins de première ligne, comment on peut tirer profit des approches interdisciplinaires.
In 2014, the College of Family Physicians of Canada published The 7 Wonders of Family Medicine Research, showcasing key developments in our field. These developments include the impact of patient-centered care on health outcomes and the use of electronic medical records to enhance our understanding of chronic disease.
En fait, la recherche est considérée comme un aspect essentiel du profil professionnel en médecine de famille du Collège de médecins de famille du Canada, qui décrit les responsabilités collectives des médecins de famille au Canada.
Une autre chose, évidemment, où on doit investir pour soutenir la recherche en médecine de famille, c'est vraiment de soutenir le développement du goût de faire une carrière de recherche comme médecin de famille auprès de nos jeunes médecins de famille.
To be able to study the effectiveness of interventions in primary care, we really need to study them in the real-world setting. And so that's where practice-based research networks come in.
If primary care is the engine of the healthcare system, then primary care research, and in particular, practice-based research, is the engine of the effectiveness of primary care.
Currently, many large groups and networks of hundreds of primary care researchers are undertaking groundbreaking work across the country. Examples include the 12 community-based primary healthcare innovation teams funded by the Canadian Institute for Health Research. There is also the SPORE network in primary and integrated healthcare innovations and the Canadian Primary Care Sentinel Surveillance Network. These and other practice-based research networks across the country are expanding their reach and engaging new collaborators to improve the healthcare for and the health of Canadians.
What primary care needs right now is strong advocacy to make sure that politicians, policymakers, research funders, and the population know the importance of primary care and well-supported primary care.